Scott, this new conversation is the result of traditionally conservative states like Missouri and Oklahoma voting to expand Medicaid. Today, I spoke with a healthcare advocate who says it's time for Mississippi to expand Medicaid as well. Mississippi is one of 12 states that has refused to expand Medicaid. The coronavirus and rise of unemployment has healthcare advocates pushing for Medicaid expansion.
Well, the coronavirus has highlighted the fact that everyone needs access to medical care, period.
Beth Orlansky from the Mississippi Center for Justice says a lack of health insurance can be deadly, especially with COVID-19.
Those without insurance are hit even worse, and so this time makes it even more clear that we have got to take care of people who fall into the coverage gap.
This coverage gap is roughly 180,000 people in Mississippi. These are people who don't qualify for standard Medicaid, but also don't qualify for subsidized insurance under Obamacare.
And I would just urge the legislature to think of the 180,000 people who would be covered. That's a lot of people, and they really need our help.
Healthcare advocates have to rely on a bill successfully making its way through the state legislature, or 106,000 signatures for a ballot initiative that wouldn't make a ballot until at least 2022. The state legislature meets again on October 5th, but Medicaid won't be on the agenda this year.
I know that no Medicaid expansion bills came out of committee or were brought up in committee this year. So it would have to be in January of next year when it would be introduced. And then I think if we have any type of Medicaid expansion, I would think that it'd be very limited.
Governor Tate Reeves, along with many Republican state lawmakers, have been opposed to Medicaid expansion. The reality is the conversation of expanding Medicaid in Mississippi will be just that, a conversation until at least 2022. And the federal government does cover 90% of Medicaid expansion costs, and the state will be responsible for the remaining 10%. Now, some of the hesitation from lawmakers is that additional spending from the state. Live in Jackson, Cecil Hannibal, 16 WAPT News.